Hi everyone, my name is Dr. Lai. I'm a pediatric physician at the American Family Children's Hospital in Madison, Wisconsin. I'm here to talk to you guys a little bit about my experience in the emergency room during this COVID pandemic and what we generally look for when we suspect a patient may be infected with COVID. So after we get the patient in the room, we check their vitals. So that includes blood pressure check, temperature check again, a heart rate check, and also a rate of breathing check. And extreme highs or extreme lows of those values could indicate that the patient is having trouble fighting off whatever disease they have, and it may prompt the doctor to order certain medicines to be available to be given or get certain respiratory machines available to help with the breathing so you can oxygenate your blood. Next, the physician will come in and do the physical exam. It's specifically, one of the most important ones is the lung exam, in which they will listen with the stethoscope to your back and ask you to breathe in and out. So things that I'm listening for are like some high-pitched noises or maybe some like dull noises as well that could indicate that there's some kind of lung damage or pneumonia sitting in your lungs. And then I'm also looking for wheezing, which could indicate like mucus plugs and air can get into your lungs but not get out. There's also fine crackle noises that kind of sound like a plastic bag being rubbed together that indicate fluid accumulation in the small lung air pockets as well. So now that you've been examined by the doctor and you've been helped by our medical team, there are like 3 different options that we decide upon. So one is that we send you home so that you're not in a high-risk exposure setting, and tell you to come back if you develop any of these worsening symptoms. The next is to follow up with your primary care doctor. So the primary care doctor has a lot of resources in which they can do telemedicine or do a lot of appointments by not having you physically come in. And so that's a great option for people who need a little bit more surveillance and a little more peace of mind. And then lastly is that we can admit you to the floor. So if we have an extremely worried mother or like you're not doing great and we think that you could benefit from some rescue medications or just some additional like tender loving care, then we'll admit you to the floor for like some nurses to check up on you from time to time and for some doctors to also like come in and examine you once in a while. That is a catch-22 because if you're in a healthcare setting, you have a lot more chances of being exposed to like other diseases and also COVID, just because we try to be as sterile as possible, but I think there's always an increased risk not being isolated for sure. So ideally, like we don't try to pack our floor with a bunch of patients if we can help it, but we certainly will do so if it's better for the patient. So at UW, we're actually pretty fortunate in the amount of PPE that we have available. Every employee that works at the hospital will have to wear a face mask. And then also if you're interacting with patients, you have to wear this face shield that protects like your eyes and also the mask in front of you. And it allows us to recycle a lot of our materials. And then we'll also have N95s, gowns, and gloves for any COVID positive patient that we are screening for. Everyone who walks through the emergency department will get a screening questionnaire of common symptoms and their temperature monitored. And if any of those are positive or suspicious for COVID, we'll actually room them in a private, isolated room away from the rest of the other emergency room patients. So as someone working in the healthcare setting, my day-to-day life at work has definitely changed. We try to limit the amount of physical interaction time that we have with our patients by gathering a history like over the phone or over webcam, and then completing the rest of our appointment in the room in the next like 10 to 15 minutes, just to limit the amount of face-to-face contact that we have. Now, I think that COVID is something that is going to affect everyone's life for at least the next year or so, or until a widely distributed vaccine comes out. So the best thing I can suggest for you guys is to be your own best advocate. Understandably, it's not realistic for you guys to stay at home for the next 6 to 12 months. But if you can try to wear a mask when you go outside, try to keep 6 feet of distance between you and another person. And if you are going out to socialize, bring your own drinks and utensils and snacks. And also just stay well informed. The CDC has some really good guidelines, and also staying well informed of like what your state regulates or what your county regulates is an awesome idea. Thanks so much for having me for this talk. Stay safe out there and really look out for one another. If you guys have any questions, also feel free to email me. Bye.